I'm Dr. Jennifer Williamson. I'm a new resident internal medicine physician at the Brookings Clinic. I recently moved here from New York. Prior to that, I lived in the Caribbean, in the Bahamas, and Jamaica, where my roots are. So the insulin is there, but for some reason there is some resistance to the insulin work, meaning at the cellular level, when the insulin circulates and goes around and it tries to act on the cells to get them knock open, take up this sugar from the bloodstream, and nothing is happening there. So it's just like you have a bloodstream full of sugar floating around in the body, and for some reason it's not getting into the cells where you need it to be for energy and for all the different processes that the cell participates in. Good glucose control, the diabetic patient should work along with his or her doctor, dietitian, and diabetes educator to ensure that he or she attains normal weight, normal blood pressure, and normal cholesterol levels. There are no foods that are barred for a diabetic patient, and I want to be clear because many diabetic patients are frustrated thinking that I cannot eat this and I cannot eat that. It's based on your caloric requirements for the day. And each person, it's a highly individualized requirement. It's based on your height, your weight, and your activity level. So in conjunction with your dietitian, then you would sit down and tell them what are the kind of foods you have in your cupboard at home, what are the kind of foods you like, and you would work out for the day how many calories you're entitled to, and then you eat within that limit. So we call it's like a calorie controlled diet. It's not a restricted diet, it's just that you eat within the limits of your diet. Of course, I want to encourage diabetics to avoid too much of refined starches like the processed foods, too much of the cookies and the cakes and all that. Try to limit your intake of those because those are refined starches that require a higher burst of insulin in order for them to be absorbed. And also with the goal of controlling your cholesterol or having normal cholesterol, also choose foods low in saturated fats. And these are things that your dietitian will help you. It's so important when you are a diabetic that you have meetings with your dietitian to learn how to read labels, to learn how to understand all these phraseologies. What are they saying? What do they mean? So it will become just a regular thing for you to know how to check when you're shopping. Okay, let me pick this one over this one, and let me know how to mix and match my diet to stay within my requirements. Exercise should be a cardiovascular exercise, meaning when you work out, your muscles should not just be, I walk all today and my muscles in my legs are tired. You should work out till you feel that your heart is pumping and moving. You could actually feel your heart pumping. But of course, before you participate in any exercise program, please discuss your plans and have yourself assessed by your physician. On average, 150 minutes of regular cardiovascular exercise per week. And you could split this into like 5 days, 30 minutes each time. Not just walking, although walking is good, but if you walk in, it shouldn't be at a leisurely romantic pace. Although if you have other comorbidities such as degenerative joints and that's all you can do, then fine, it's doing something. But if you are well and able and capable of walking fast to the level where you could feel your heart actually pounding, then that is better than just doing nothing at all. There are two ways of monitoring. There's at-home monitoring, which patients do with their glucometers, and there are so many brands of glucometers on the market. So the blood glucose is checked at home. We recommend that you check the fasting in the morning. So you wake up in the morning, the first thing you do before you have the breakfast is check the fasting levels. And on average, the ranges that we're looking for is 80 to say 130. 2 hours after each meal, in addition to the fasting sugar, is what we are looking at because we have, again, target for those postprandial, as we said, after eating, postprandial value should be in the range of 180. And then to tell us how well you're doing over a 3 to 4 month period, we utilize the hemoglobin A1C. We can tell what percentage of sugar or glucose was attached to your blood cells over the past 3 to 4 months. And target values for the diabetic patient, no more than 7% of your red blood cells should have glucose attached to them. So if you get a HbA1c number of greater than 7%, it means that your diabetes has not been controlled. By large and by far, most patients will require either insulin if you are a type 1 diabetic, or if you're a type 2 diabetic whose insulin stores has run out. So in other words, if you're insulin deficient or insulin depleted or have no insulin at all, you will require insulin. And patients who have insulin but they are insulin resistant, which is a larger percentage of the type 2 population. Then we have medication that are insulin sensitizers to help the cell. Whenever the insulin go around and say, knock, knock, please let in the sugar, then we have medications that will help the cells to open their doors and let in the glucose so that the glucose can go where they are needed, where it is needed, which is inside the cells and not floating around in your bloodstream causing havoc. So just by doing those basic measures, following up with your healthcare professionals, taking charge of your life by such as exercising, sticking within the limits or within the constraint of your calorie requirements for the day, keeping your blood pressure normal, keeping your cholesterol normal. It sounds like a lot, but in the end it's rewarding, and I've seen people very happy with the results that they were able to accomplish just by being empowered. So if you need encouragement and you need support, work along with your physician, work along with your diabetes educator, work along with people who are positive. If you have positive family members, work along with other diabetics who have done it before, and be empowered to know that yes, it's a chronic condition, but yes, most of the control resides in your hand, and it's very rewarding. Once you're doing what you need to do and the results that you achieve, you'll be very empowered.